effective vaccine that can stop people dying, but is not enough to stop the transmission of the virus. And in that case, you would give it to a much smaller number of people. Now, clearly, in that second group, you are absolutely doing it only to protect the person who is being vaccinated. And if they choose not to have that protection, it doesn't affect anybody else. That is simply their choice. But then they obviously are denying themselves the protection that this kind of vaccine could provide.
Thanks very much, Chris. John?
Well, Secretary, so just a more general observation about vaccine programmes, that the most successful vaccine programmes tend to be by consent. So what really matters is clear explanation of the benefits and risks, any risks that are associated with the vaccine, and a really good system to make the vaccine available to everybody who needs it. So although some countries have adopted mandatory programmes, the most successful programmes tend to be done on the basis of consent, good information, and good delivery mechanisms. But clearly, mandation is there, can be used in some instances.
Thanks very much, Professor Newton. We'll now go to Laura Koonsberg of the BBC. Laura.
Thank you very much, Secretary of State. Did the Prime Minister change his mind on making health and care workers from overseas pay towards the NHS, or was he just worried about losing a vote? And can I ask you also on social care, can you confirm that you are planning to introduce a cap on care costs in England, and do you accept this crisis has shown that reform of the system cannot be put off again?
Thanks, Laura. The Prime Minister has asked the Home Secretary and I to work on how we can remove NHS and care workers from the NHS surcharge as soon as possible. And I'm very pleased to be able to do that. I've already spoken to the Home Secretary, and we'll be saying more on how we do this in the next few days. The Prime Minister has clearly himself been a beneficiary of carers from abroad, and we've talked many times during this crisis about the enormous contribution that people from overseas make to the NHS and to social care. So the purpose of the immigration health surcharge within the NHS is a fair one, and the purpose is to ensure that everybody contributes to the NHS, but also those who work within the NHS and within the social care are themselves making that contribution directly. So So the Prime Minister has made that decision, and he's asked us to make it happen. On social care more broadly, as you know, we put in the manifesto on which we were elected the need to reform social care. I would say that the crisis has demonstrated the need to bring health and social care closer together. Colleagues in social care have worked so closely and are working so closely with the NHS, much more closely in this crisis than I have ever seen before. Yet there are organisational and bureaucratic boundaries that hold them apart. And so I can confirm that we're working, as we set out in the manifesto, on making sure that social care is as strong and sustainable as it possibly can be in the future, so that we have a sustainable system that gives people the dignity that they crave as they grow old, and for adults of working age.
Can I come back on that?
Yes, of course.
Yeah, can you tell us when that plan will emerge, and can you confirm that that would include a cap on care costs for individuals, sometimes who end up having to sell their homes in order to pay?
Well, we have been clear on that second point, absolutely, that people shouldn't have to sell their homes to pay for their care. That principle's very clearly set out in the manifesto, and it's something that I think is very important. And I've seen the injustice of, it's impossible to know in advance whether, especially in older age, whether you're going to need care or not. And there is no system of insurance for people to be able to do anything about those costs. So I've seen the injustice of that. We've set out that we will address that as part of the reforms in the manifesto. And I'd love to give you an update on timing, but we have got all the urgent work on coronavirus to deal with at the same time. And so I'm not able to give you any firm commitment on timing, I'm afraid. Thanks very much. Dan Hewitt from ITV. Dan.
Good afternoon. Good afternoon, Health Secretary. Research from the Food Foundation shared with us showed the number of households struggling to get access to enough food, or skipping or rationing meals, has doubled since the start of this crisis. That includes 1.7 million children. given we don't know when this crisis will end, does the government have a long-term plan beyond what it's already done to help millions of struggling families? And secondly, if I may, yesterday the Prime Minister insisted it was the right thing to do and to charge migrant health workers to use the NHS. Now he says it's the wrong thing to do. What exactly happened in the last 24 hours to make him change his mind?
Well, the Prime Minister yesterday gave an answer about the immigration health surcharge as a whole and has asked the Home Secretary and I to work on making sure that NHS and care workers don't have to pay it. So that's the explanation to the second part of your question. On the first part, you're absolutely right to ask about this. It's incredibly important. It's something that we worry about, making sure that people get access to the basics, no matter what their circumstances. We've introduced the programme for those who are being shielded because they're clinically vulnerable, 2.2 million people who have the offer of support, and we've delivered over 1 million food parcels to those who need them, who when they're contacted by the NHS are asked, all of those 2.2 million are asked, do you need help, for instance, with food? And we've been able to give them that support and also connected them to supermarkets, and I want to pay tribute to the supermarkets who've done incredible work for the shielded. But there's also a group of non-shielded people who are vulnerable. And they may, in some circumstances, they might not be clinically more vulnerable, but they are vulnerable. And this is one of the many impacts, one of the many bad things about this virus, is it can be harder for some vulnerable people to deal with the consequences of the virus, like all the social distancing. And so we have a programme in place to support them as well. And we've put significant amounts of money into the shielding programme and local support, coordinated locally by councils. And it's an incredibly important part of the support, and I think you're absolutely right to raise it down. Thanks very much. Beth Rigby from Sky.
Thank you. Secretary of State, the government's own COVID-19 recovery strategy states in black and white that an app system needs to be built and successfully integrated for the track and trace system to work. But now the government's saying the system can function effectively without it. Was your strategy document wrong, or have you moved the goalposts? And if I may, to Professor Newton, Oxford scientists who are advising the government on the contact tracing app say test results need to come back within 24 hours to stop the spread of the virus. I know you've just announced this new swab trial, but how long do tests take at the moment?
Thanks, Beth. So on the first one of those, we're absolutely clear that the test and trace system needs to be in place, and that is on track for delivery by the 1st of June. And as you know, we've been hiring the contact tracers, and we've hit the deadlines for those, and they are in place, 24,000 as of yesterday. And we have got the testing capacity, and the technology is an important part, but it is not the only part. And in fact, one of the lessons from the Isle of Wight is that getting the human contact tracing in so that people understand the consequences of if you have been in close contact with somebody who tests positive and somebody calls you and asks you to therefore says that you have to self-isolate, that is it is important that that is done properly. The app is, as you know, working in the Isle of Wight. We want to make sure that this whole system lands well and supports the ability safely to make changes to social distancing rules. And the system will, as the Prime Minister said yesterday, we have high confidence that the system will be in place by the 1st of June, and then it will grow stronger and stronger. John.
Thank you, Secretary of State. Yes, it's a good question. It's important to understand that the test and trace programme has more than one component, and core to this is the public health contact tracing, which is used internationally. It's recommended by WHO. It's public health good practice. We used it in the containment phase. So somebody who tests positive is contacted and asked firstly to self-isolate themselves and for their household to self-isolate, and then they'll be asked about their contacts, their close contacts. And those contacts are then contacted and informed and given advice. That's a process which is completely independent of the proximity app, although it is in fact it's augmented with an online information system which is web-based. And this will all become a little bit clearer when we introduce it. But all that work is now in place, and we are ready to go with that system. And in fact, it was used, as I say, in the containment phase, and we've had a very successful trial of it in the Isle of Wight. In addition to that process, for people in the general public, the app is an additional component which tells you if your phone has been close to another phone with the app, in such a way that you might have been in contact with somebody who have the risk of passing on coronavirus. So that can be layered on top of the more personal contact tracing, which is driven by the public health process and the telephone process. So they are distinct but complementary, and it's perfectly okay, in fact possibly advantageous, to introduce the one before the other. Thank you.
Thanks, Beth.
And in terms of the timing of the test, so you're absolutely right that the sooner the tests come back, the sooner people can be alerted about their risk and the more effective the process is. So we're working very hard to get these turnaround times down. At the moment, 90% of tests come back the results come back within 48 hours of the test being done, and almost half of those are back within 24 hours. So many people will get the result the same day, but we're introducing various ways of reducing that time to the absolute minimum. Thank you.
Can I just ask though, do you accept that you do need to get the tests back within 24 hours for the system to work? Because obviously a lot's riding on this in terms of public confidence.
Yes, indeed. There's no specific cut-off. The sooner you can get the test back, the better. But we've been in discussion with modelers at SAGE, and models have been built based on 80% of the tests coming back within 48 hours. So we know that the effectiveness would be there with pretty much the level of performance we have now, but we would like to get it better. We would like to get the test back even more quickly, because we know that it will be more effective if we can do the testing more quickly.
Thank you very much.
Thanks very much, Beth. Laura Hughes from the FT.
Afternoon. Can I ask, if we never needed this app to launch a track and trace system, why is it still taken till the 1st of June to launch this army of human tracers? Could we not have got them in place earlier while we were ramping up testing capacity? And also ask, how many daily tests do you estimate your new test and trace system is going to need for it to work?
Yeah. Well, two very good questions. I'll ask John Newton to come in on it. The point about the app is working in the Isle of Wight. But rolling an app out, especially one of such significance, because if you download the app and you've been in close contact with someone, it tells you that you are at higher risk of having caught coronavirus. We want to make sure that rolls out in exactly the right way. And one of the things we've learned from the Isle of Wight is making sure the importance of getting that order. So we've chosen to do it in this order. And the reason that for the timings is that it interacts with the changes and move to step 2 of the lockdown, which is scheduled to happen no earlier than the 1st of June. Whilst we're all in lockdown, the implications of being told that you yourself need to go into lockdown are smaller than as those social restrictions ease. And so that's the interaction with step 2. The critical point is that we, of course, when the number of new cases was much higher, then the ability to do the contact tracing is much more difficult and less effective. But as Professor Whitty has just demonstrated with the new statistics published this morning from the Office of National Statistics, with around 61,000 new cases per week, that is the sort of scale that the contact tracing that we are bringing into place will be able to grapple with. And we've always said that the test and trace system will be more effective the lower the number of new cases, and social distancing is bringing down that number of new cases to a point where the test and trace system will be able to hold R down. John, I don't know if you want to add anything. Or
Well, Secretary of State, you put it very well. The time for the test and trace programme is a little bit later on as social distancing starts to relax. And in terms of the numbers, and of course we haven't stopped doing contact tracing. The Public Health England still does contact tracing to investigate outbreaks, for example, at the moment. So it's a question of increasing the scope and the scale at which we do contact tracing in a progressive way. And hiring the staff, the core public health staff who do the more more complex contact tracing are already in place and have been in place throughout. But we're recruiting additional staff as they're needed. It clearly wouldn't have been sensible to recruit 20,000 people and have them not doing anything. At the moment, they're going through training and making sure that everyone's ready for when we do need to introduce the new programme. So I think it's all being introduced in a very measured and effective way. In terms of the numbers, as Professor Whitty pointed out, the ONS estimates there may be something like 10,000 new cases a day at the moment. We're seeing around 2,000 positive tests a day. So these are very manageable numbers, and the trajectory is for those to decline at the moment. So those are very manageable numbers for the test and trace programme to take on. Thank you.
Thanks very much. Yeah, of course.
If I could just follow up very quickly.
Yeah.
Is there not a risk, though, that as you introduce this new system, you're also loosening lockdown measures, so people will be going back to school, for example? And are you not concerned that the number of daily infections could start to go up? Is there a point where we see the levels so high that this system stops working because we don't have the capacity to deal with it anymore? Do you have a figure for that and a threshold under which you might have to roll back this system because it won't be able to work anymore?
Well, we now have, through the surveillance testing, a much greater clarity on what the level of R is, and a clear goal that R shouldn't go above 1. And that is in place to mitigate against exactly the scenario that you set out. The goal is to keep the number of new cases coming down whilst lifting measures as is social distancing measures as much as is safely possible, but with the emphasis on safety. And of course, once with a test and trace system in place, that will allow us to do more on the social distancing release safely. And so the two need to be seen hand in hand. It's all about how do we manage this epidemic down using a more targeted focus on people who are higher risk because they've been in contact with someone who's tested positive, rather than the blanket measures that we've got in place at the moment. Thanks very much. We now go to Robbie Savage. Robbie.
Thank you. Thanks for allowing me to ask this question as a Daily Mirror columnist and a grassroots football coach. It is Mental Health Awareness Week, and we all know how important all sport is as a contributor to achieving healthy minds and bodies. Why, therefore, is it that in published guidelines by governing bodies that junior tennis players, golfers and athletes are able to receive one-on-one coaching sessions, but young people who play the working class game of football are currently not allowed to?
Thanks, Robbie. Well, it's good to have you, and thanks for taking part in the press conference. Look, I absolutely get the impact of this virus on people's lives and the mental health impact. And for many people, being able to play football is a huge release and a really positive thing. And the rules are there. Of course, they can go out and exercise, but I know that exercising just with members of your own household or on your own is nothing like being able to play football. So I get it. I understand why it's a problem. Unfortunately, these rules have to be in place amongst the population as a whole, because we've got to get a grip of this virus. And it's only by following it, the more people follow the rules, the faster we'll get the number of new cases down, and the more we're going to be able to release social distancing rules. But you don't just want to hear from me.
Can I just?
Yeah, of course, yeah. And then I'll ask
back in,
Chris
please,
Whitty
quickly.
to come in, yeah.
So why are some governing bodies, allowing one-on-one coaching with under 18s, whereas the governing body, the FA, aren't allowing, the under 18 getting coached one-on-one? Why is it different?
Chris.
So fully understand the reason for the question. And I mean, to absolutely reinforce your point, exercise of all sorts is good for physical health, good for mental health. And that's one of the reasons we were very keen in the first very tentative easing of some of the lockdown to make it easier for people to do things outdoors. And if it's within their own family, then a kind of kick around in football, if we're within the same household, a kick around in football is fine. So the difference, and this is one of the issues that we need to think about a balance. And I think with all of the things we're trying to do, it's about trying to release where we can, but not take the risk that we actually start having the transmission again. And we were very confident that it is much safer to do the same thing outdoors than indoors. So that's the first thing, and that's part of the reason we were able to do things. But as you know, the rules are, except within your own household, it's one other person at 2 metres. Now, it's quite different, and that is a small increment from where we are. Now, it is possible to play the kind of sports you're talking about at 2 metres with one other person or within your own household. Clearly, to have a kind of league football game, which is a contact sport and does involve a larger number, the risks are greater. So the question is, at what stage, accepting that outdoors is safer than indoors, but that a group of 22 people, many of them coming into contact with one another, linking their households, is a much bigger risk than 2 people who are at a 2 metre distance. At what stage do we think that the rate is low enough for that to be a safe thing to do? So that's the logic for this very, very gradual move, because we are very keen both to try and make it possible, particularly for people to do sport and exercise outdoors, for all the reasons you give, but also not in the process of that to link households again and start the process of the R going back up again. So that's a long answer, but that's because it's a very serious question.
So can I have one more question, please?
Yes, you can.
Secretary of State? So obviously, can you or your scientific colleagues give an indication of the pathway to grassroots football being allowed to restart? Do you think we will have to wait for a vaccine?
Well, I very much hope that we won't have to wait for a vaccine. The first thing I'd say is that some of the projects we're putting in place, like this test and tracing that we've been talking about, are there to try to hold the number of new cases down whilst allowing more social distancing measures to be lifted. And this is one that we can look at, and we had a discussion about last time round. And Chris is better placed than me to advise, how much of an impact upwards it would have on R and how much further we can go.
Well, I mean, my expectation, and Sir Patrick Vallance's expectation, this is one of his areas of trade, as a government chief standing advisor, is that a vaccine before next year on a widespread basis is very unlikely. So I definitely hope that football will be available, possibly with some degree of change of how it's played. There may have to be some ways we have to think it through in advance of a vaccine. But I think what we're trying to do is go very, very cautiously along that path that the Secretary of State talked about. But my very strong hope, and I'm sure this is the strong hope of everybody, is football is well before we get right out to that the right-hand end of that path. Because outdoors is safer than indoors, no doubt about it, but mixing large numbers of people in a contact sport is unfortunately a higher risk of transmitting this virus inevitably than something which can be played in 2 or maybe 4 people at a distance.
We want grassroots football back as soon as we safely can. Thanks, Robbie. Great to have you on.
Thank you. Thank you very much.
Last question is from Ian Swanson from the Edinburgh Evening News. Ian.
Thank you. I wanted to ask a couple of points about the hospitality and tourism sector, which is a crucial part of Edinburgh's economy and potentially one of the last to reopen. From August, employers will have to contribute to the cost of furlough. Many bars and restaurants say if they're still closed, that will be impossible. And even when they can open, social distancing might mean that it's just not viable. So will the government continue full funding of furlough for this sector? or is there some new support that it could offer? And secondly, many hospitality businesses fail to qualify for the Retail Hospitality and Leisure Grant, often just because their city centre location pushes them over the threshold of 51,000 rateable value. Is that something that you would also consider reviewing?
Well, thank you, Ian. The furlough rules have been set in place as one of the most generous schemes in the world, and I'm very pleased that the Chancellor was able to extend them from the deadline this side of summer up to October. Clearly, the details of how it operates is for him and for the Treasury, and I'll take your comments back. I do understand the importance of it, especially in Edinburgh, which, especially during August, traditionally has always relied on such an enormous influx of visitors for the biggest festival, certainly in the country, if not in the world, with the Edinburgh Festival. So I understand the specific concern, and I'll take that away and talk to the Chancellor about it. That concludes our daily briefing. Thank you very much indeed for all of the questions, and hope to see you again soon.